Well, welcome back. We are continuing the conversation on the often not mentioned side of breast cancer when it returns in a different location in the body. Joining us back is UT Physicians orthopedic surgeon, Dr. English, along with his patient, Jennifer Breidel, whose breast cancer journey began in 2016. Doctor, welcome back. And Jennifer, nice to meet you. Thanks for joining us today. You are also a registered nurse, and talk to us about what you first noticed back in 2016 when you thought something was amiss.
Overnight, I woke up with a lump. That was very painful.
And you were very vigilant about self-checkups and routine mammograms, is that right?
Yes, I just had a mammogram 7 weeks prior to that. Normal.
And so your diagnosis basically came shortly after that with breast cancer, and in May of 2016 you started treatment, and yes. July of 2018 you completed treatment, and you were basically pronounced no evidence of disease, and we're looking at some photos. I'm guessing that is of after treatment as well. And what was that like going through all of this for you?
The first time, very difficult. I had no idea, even as a nurse, what it was going to entail. The chemotherapy is really hard on your body. It's important to follow the direction of the doctor, do everything they tell you to do. It's so important in order to get through it, because it is so bad, meaning like fatigue and losing your hair is nothing compared to what else can go wrong.
Right. And then fast forward, if we will, 2 years later is when you felt some different pain, and was that localized in your hip and leg area?
Correct. My right hip and my right leg. And I also had just had scans 5 months prior, so it was looked at as my low back, and we'll watch and see.
And that's basically when, Dr. English, you were called in and looking at her scans. And this is why we're talking today, because this is what can happen when the cancer metastasizes to the bones. This is what was the course of action next.
Exactly. So first off, I'd like to congratulate Jennifer on doing a great job with her surveillance scanning and sticking with her oncologist, Dr. Kadali. So I think that she was in good hands, and they had regular checkups for her to make sure that the breast cancer had not traveled anywhere else and not recurred. And we do these at certain intervals, and sometimes with especially aggressive cancers, it could come back in between those intervals. And so for Jennifer, the cancer started in her, or went to the femur, and the cancer produces chemicals that destroy the bone and lead to pain and eventually fracture. And so when I met her, she had come into the emergency department because her leg was broken.
And I understand, too, that recently, October 14th, you completed your radiation, you rang the bell. It's an interesting and timely topic. And thank you both so much for being here today, Dr. English and Jennifer Breidel. Thank you for sharing your story.
Thank you.
Thank you for having us.
And if you would like more information to schedule a consultation, you can visit utphysicians.com or simply call 888-488-3627. I'm going to toss it over to Derek.